Stephanie Bell-Flint joins us now to talk about the first OBGYN visit. And if you have questions, you can send them to the doctors at WLBT.com.
What do you want to know? I'll tell you anything you want to know.
My first visit is long gone.
We've got actually an expert here, Dr. Barbie Sullivan, the new Executive Medical Director of Women's Services at Baptist Medical Center. Congratulations on the new position.
Thank you.
And also the question about when to go to the OBGYN.
Well, what we recommend is that women between about 13 and 15 have an appointment either with their pediatrician or their gynecologist to talk about things like, you know, sexually transmitted diseases, if they need to talk about that, to talk about vaccinations, and then just things like, you know, are you smoking, you know, not smoking, not drinking, are you exercising, taking calcium, you know, all of those things. And then between 18 and 21, and really depending on risk factors, start the first pap smear.
Now, we were talking the other day about how girls are at younger ages now beginning their cycles, and there are a lot of things that mothers as well as their daughters need to know. So should they wait before they start their cycle, or definitely after, before they have that first visit?
And you know, what I generally say is start at that age, start with your pediatrician. And they'll guide you. If they feel like that a patient needs further evaluation with an expert, or, you know, they'll send you to us. But start with the pediatrician and then come to us if they feel like that's necessary.
Because really, if you go to, I guess you could probably say, if you go to an OBGYN too early and you don't have those risk factors, it can scare girls.
And I think, you know, that first appointment, many times on the first appointment, I won't do a pap smear, won't do a pelvic exam, but I just generally sit down and talk and sort of prepare them for, you know, what's going to happen with that first exam. I mean, don't we all remember our first pap smear?
Oh, yes.
That's one of those things that you just remember.
Oh, yeah. Mine was just last year.
You don't,
I'm kidding.
but you don't want it to be a traumatic experience. You don't, you know, my goal is that to be a good experience so that you're coming back every year. That's the important part of it.
Okay, well, we've got a question. It says, I have always had crazy menstrual cycles and HMB, but without meds, my cycles just keep getting shorter and shorter, like 23 to 24 days at the most. Considering I don't have any health insurance right now, is there anything I can do to lengthen my cycles? 23 days comes way too quickly.
Yeah, and I agree as a woman that that's way too quick. But that actually falls under the realm of what we would consider normal.
Really?
So 21 to about 35 days is normal.
What a headache. We're sorry she didn't answer that better.
Sorry.
Bless her heart. Now, what about young girls that get extreme cramps? Could they have fibroids, or what would you do if you have, say, a 12, 13-year-old and they have cramps where they have to miss school? And I've heard of girls like that.
Yeah, and I see young girls all the time in that age group that have bad cramps. And generally what we start with is something like Anaprox or Aleve, Advil, over the counter, get it in the system early and keep it there, which means, you know, every 8 hours taking something, just like you would if you had a strain, a muscle strain or that kind of thing. If that doesn't work, sometimes we actually use birth control pills in that age group to help with menstrual cramps.
What causes them, and is it worse in younger girls than it is women?
Well, you know, there are some women, I mean, I'll see women in their 40s and 50s who say, what is that? I don't know what a menstrual cramp is. And then many women have cramps. So it's one of those things that's variable among women. Not everybody has them. They're mostly caused by progesterone effects that happen with the menstrual cycle. The uterus is a muscle. We know that. It contracts, so you know that's part of it. And then endometriosis can also be a big cause of menstrual cramps in young girls.
Wow. Can they have fibroids?
They can. They can.
Wow.
It'd be uncommon, I would think, though.
It's not as common. Fibroids tend to get larger, you know, as the years go on, but there are some younger women who will have some fibroids also.
Let me get an update on this, is kind of related to what we're talking about, but the Hpv virus or shot vaccine.
Right.
Are people continuing to get that, or because I read a study, I think, where it was people were getting 2 of them, but not 3 of them, you know,
Right.
the full course or whatever?
Well, I certainly hope people are continuing to get that. The pediatricians are doing a great job of offering that to young girls, but we're still seeing some in the young college age or high school age that haven't had their HPV vaccine. I recommend every woman get the HPV vaccine. It prevents cervical cancer.
So yeah, we do need to get that. I mean, it's shocking to me that people don't get it more, but I'm not sure if it's covered by insurance. I'm not sure, I know it hurts, so there's
It's
a scare
shot,
factor
so
there.
there's absolutely.
Are mothers just scared because they're making that decision for their child?
Well, I think what I hear from a lot of mothers is that they feel like, just like maybe with starting birth control pills for a medical issue, they sort of feel like, well, maybe that's telling a young girl it's okay, to have sex or that kind of thing, which is not at all what that is saying. We know the HPV virus is sexually transmitted, and the way that I explain it to moms is that I see women all the time who have the HPV virus. They may have waited until they got married to have sex for the first time, but maybe their husband didn't. And we don't control that. So still, you want to protect your girls.
That's a good way to put it there.
Yeah.
Thank you, Dr. Barbie Sullivan.
You're
Thanks so
welcome.
much for joining us.
Thank y'all.
And for more health news, you can log on to our website, WLBT.com, and click on Medical Matters.